A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
Here are some heart disease facts from the Centers of Disease Control. It is the leading cause of death for men, women, and people of most racial and ethnic groups. One person dies from cardiovascular disease in the U.S. every 36 seconds at a cost of $363 billion yearly in healthcare spending. Heart disease accounts for 1 in every 4 deaths in the U.S., and about 18.2 million people aged 20 plus have coronary artery disease. On this edition of your Hometown Health Connection, we will get important life-saving information you need to know from a leading cardiologist and nurse practitioner from Great Lakes Cardiovascular on this edition of your Hometown Health Connection. I am Kate Glazer. Welcome to the program. Today you are going to meet Dr. Vijay Iyer, an interventional cardiologist with Great Lakes Cardiovascular, director of the Complex Valve Clinic at Buffalo General Medical Center, and director of structural heart interventions at Gates Vascular Institute and Buff Gen Medical Center. And Marylou Scholl. Marylou has been caring for cardiovascular patients for 34 years, spending the last 22 as a nurse practitioner at Great Lakes Cardiovascular. She sees patients in the office and the hospital for conditions like heart failure, heart attack, coronary artery disease, high blood pressure, high cholesterol, diabetes, open heart surgery, stents, valve procedures, heart rhythm issues, and individuals taking blood thinners, which can be impacted by diets. Our guests are from Great Lakes Cardiovascular with locations throughout Western New York. Great Lakes Cardiovascular brings together some of the most respected cardiologists in the country to bring world-class care. We begin our conversation with Dr. Iyer. Thanks so much for being here.
Thank you for having us.
You are at the forefront of so much that is happening in heart health and particularly in interventional cardiology. What exactly is interventional cardiology?
Interventional cardiology is a subspecialty of cardiology in general. These are individuals who are trained in dealing with heart conditions using catheter-based technique or minimally invasive techniques. So interventional cardiologists do procedures like angiograms, angioplasties, valve replacements, closing holes in the heart without doing open heart surgery.
I'm sure so much has changed over the last few years. How have things really changed in this type of procedure?
In the last 20 years, interventional cardiology has really blossomed as a specialty with a lot of new technologies coming in. The onset of interventional cardiology started with what we would call angioplasty, fixing blockages in the heart arteries using wires, catheters, and balloons. That was followed by the utilization of stents that most people are familiar with to fix blockages and including acute heart attacks. In the last 10 years, we have evolved into a further subspecialty of interventional cardiology called structural heart interventions, wherein we are now able to fix valves or replace valves without open heart surgery, plug holes in people's heart, plug left atrial appendage to prevent clots, and a number of other specialty-related catheter-based interventions that are still being developed with are either early in trials, a whole novel way of dealing with cardiovascular problems.
That's so impressive to me, being on the outside looking in, how you are able to deal with all that. And Marylou, you work with patients who are in their 20s and patients who are in their 90s. So really there's a complex range of ages and diversity, things like that. Can you talk to us about the importance of diet in preventing heart disease?
You know, every meal is an opportunity to affect your health. What you eat changes your outcomes. So what goes in affects the output, right? When you start dealing with younger people, healthy changes affect you for your whole life. If you can get rid of the bad habits and talk about a real lifestyle that people can maintain, you're going to change their life for the long term. They're going to feel better now and do better for the long term and live a longer, healthier life.
Absolutely. And for those who are already making some of those bad mistakes and they've had years of this, how can they really reverse that, or what's the importance of reversing their diet and their health changes?
Yeah, it's never too late. You can always start over. It's like quitting smoking, right? It's never too late. You start now and the changes just pay off going forward.
Very nice. Dr. Iyer, you have led or been involved in managing clinical trials in which only few physicians and medical facilities in the nation are invited to lead. In fact, you were the first to perform a procedure called transcatheter aortic valve replacement, a mouthful for sure. In fact, you and your team just celebrated your 2,500th TAVR procedure. Congratulations. What exactly is the TAVR procedure?
TAVR, abbreviated as TAVR, is transcatheter aortic valve replacement. The aortic valve is the valve between the pumping chamber and the rest of the body, sort of the last stop between oxygenated blood going to the rest of the body. As people get older, this valve often narrows, and traditionally, before 2010, the only way to replace this valve was to do open heart surgery. Transcatheter aortic valve replacement allows us to replace this valve without doing open heart surgery by going through one of the larger arteries, either in the leg or the shoulder or the neck. This procedure has revolutionized how we treat this condition called aortic stenosis, where now this has become the predominant way of replacing aortic valves in the elderly.
And who exactly would need a TAVR procedure?
The aortic valve typically narrows in people who are older, but there are some younger people who are born with an aortic valve that has 2 leaflets instead of 3, and they may be candidates for this as well. Most of these individuals will manifest with symptoms of shortness of breath, fatigue, occasionally lightheadedness or chest discomfort, and they are the individuals who will be candidates for this.
What does this mean for Western New York? This is a huge accomplishment, and you're really the lead of it all. I mean, what does this mean for just our procedures here locally?
Before 2010, if you needed some of the cutting edge technologies, and this is something that the Gates Vascular Institute specializes in, one of the goals of the Gates Vascular Institute from a cardiology standpoint was that the Western New York community, the 9 counties of Western New York, would not have to leave Buffalo to get advanced high-level cardiac care. TAVR was sort of the first in this step, wherein we can now provide cutting-edge changes, cutting-edge treatment without people having to leave the area.
Marylou, we are constantly hearing about whole food, plant-based diets these days. I know I've heard a lot about it. I've tried them myself, but many people don't even know what that is. So can you explain in the most simplest form what that means from your perspective?
Whole food, as the least amount of processing as possible, right? And plant-based, not meat, so can be plant-based, beans, legumes. People don't realize broccoli has a lot of protein, so you're just getting your protein from sources outside of meat.
Does it mean not eating meat entirely?
When I work with patients, I ask them how successful, how committed do they think they can be to being completely plant-based. It's very individualized, and any change is better than no change. So whatever people can do, we ease in and we build on that.
So you said broccoli is a great example, but what's really a typical plant-based meal? Give me some other, options that people can lean into.
Yeah, people, there's great sources of pasta that are not wheat-based. That is a plant-based product, but there's also a high-protein black bean pasta or lentil pasta, very high protein. And whatever sauce you want to put on that, if you want to put some garlic, olive oil, a little Parmesan, there you go.
And that's really impacting an entire family, not just the person eating that, but anyone that's around them. They're being inspired to also eat healthy too, correct?
Correct. And it's all things that you can find at your local grocery store. You don't have to go to some very obscure or specialty shops. This is all food that's readily available and easy to get into your lifestyle.
Even local farmers markets, I feel like that's a very easy, simple way, and it's not super expensive, so you're not going to those high-end stores like you mentioned. Dr. Iyer, can you tell us about other minimally invasive procedures that you are performing at your clinic?
So in addition to the standard angioplasty, so stents and transcatheter valve replacement, which we've been doing for 10 years, we can now do procedures on the mitral valve, on the tricuspid valve, to fix a leaky mitral valve or a leaky tricuspid valve. We can also replace the mitral valve or the tricuspid valve without doing open heart surgery. The same applies to pulmonic valves. So essentially, at this point, anything that had to be done with open heart surgery 10 or 15 years ago can be done with minimally invasive techniques. We do procedures called alcohol septal ablation, closing holes in the heart like PFOs and atrial septal defects. These are congenital holes. or an acquired hole. For example, sometimes people develop a hole in the heart after they've had a heart attack. Those can be closed with transcatheter techniques. The idea today, for example, of a transcatheter aortic valve replacement is people are mostly awake during their procedure with only minimal sedation. They only spend one night in the hospital. They're home the next day. They're back to their normal lifestyle within 3 to 4 days. So this is transformational in the way we deal with a lot of these problems over the last 10 years.
It's transformational for sure. I mean, the healing time, I'm sure, is just much shorter. What was a typical healing time prior to these minimally invasive?
Open heart surgeries, depending upon complexities, would involve a 5 to 7 day stay in the hospital. And if it's a sternal opening, meaning that the chest has been opened, it can take up to 12 weeks for the patient to completely heal up. And for them, it could take months to get back to normal. And since a lot of the people we deal with are elderly, many of them were not even afforded the opportunity to have open heart surgery because it would be too risky. So we take a lot of these individuals, we've replaced valves in 102-year-old people, 100-year-olds, and they have their procedures done with minimal sedation or moderate sedation. We go through the leg, they have the procedure. Many times I'm actually talking to the patients while they're having their valve replaced, and they go home the next day.
That blows my mind. It really is so amazing to see how far we've advanced, especially here locally with your guidance. Marylou, obviously each person is unique. Many people are resistant to change. I know that's something that's very hard for people. How do you work with each person to help them make some practical changes in their life?
I like to ask people what their current lifestyle is and work on one meal at a time. And it just starts with, what did you have for lunch today? They'll tell me what they had, and we'll work on some better choices, and just go one meal at a time and give them options, what to eat, how to prepare it, how to fit it into their lifestyle.
And how can other people support them? I know family is a big thing, friends. Is it really just kind of changing one person's perspective and they then shift it out to other people?
It really is. Part of the conversation is finding out why someone is motivated to make those changes. We have a lot of people who, I don't want to take that medication. Fine, let's work on your diet. We'll give it a try. Some people do need medication, but you can change a lot with diet. Some people want to lose weight, so you can work that access in without even talking about exercise. So what is their why, and come at it that way.
And diet is so simple. It's just a very simple change. It can be very complex, but then it ultimately leads into heart issues if you're not careful, right? So
Right.
this really is a very practical way to be healthy and think about that. So thank you so, so much. We will have much more with our guest after a short break with information you need to know. If you want to connect with Dr. Iyer, Marylou, and the experts at Great Lakes Cardiovascular, you can reach them by calling 716-710-8266 and online at greatlakescardiovascular.com. Great Lakes Cardiovascular brings together some of the most respected cardiologists in the country to bring world-class care. With 14 convenient locations, Great Lakes Cardiovascular offers the most innovative, non-invasive diagnostic and treatment techniques in diagnosing and treating heart disease.
Buffalo Healthy Living magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living magazine all over our hometown or go online anytime at buffalohealthyliving.com.
On a Sunday morning around 6 a.m., my wife took me into the emergency room downtown, and I was having a heart attack. Dr. Iyer was the doctor who performed the surgery. He put 2 stents in, and after that, I did all my follow-up visits with Dr. Iyer. Since I've been 23, the doctors have been wanting to put me on statins. My cholesterol since the early 20s has been between 260 and 280. Basically, I don't like statins, did not want to take them. So I never did. Yeah, I believe that if the ratio of your total cholesterol divided by your HDL was below the number 5, that I would be okay. For most of my life, it was in the 3 range. But I guess finally the plaque caught up with me, and that Sunday I had the heart attack. Yeah, and doctor called it the widow's web, is where the problem was. The diet or the eating program, more of an eating program I've been on since the heart issue, has been extremely stringent. But just to give you some numbers, my cholesterol my entire life, which I indicated was 270, within 6 months, my cholesterol was down to 150. Since then, the last 3, 4, 5 years, whichever, it's been, my cholesterol has ranged between 150 and 157 at the highest. And so my cholesterol's in shape. This particular eating program that I'm on, my weight, I didn't realize it, but I was getting a little on the chunky side. So I was up to 195 prior to the surgery. Within 6 months, my current weight is now 150. So I fluctuate between 150 and 155. All the blood tests are right. And so my goal is to prevent the heart attack from occurring again. And also, I've gotten some indications that actually the amount of plaque within my arteries is being reduced because of this eating situation. It's been absolutely fantastic. We've recommended Dr. Iyer to people who have often mentioned who did the procedure, etc. He's a phenomenal surgeon, I should say. He's leading edge in the various procedures that he's using and adopting, and his thoughts on properly eating to prevent this and or minimize it are outstanding.
Welcome back to your Hometown Health Connection. I am Kate Glazer. We are continuing our conversation about what's new in heart health when it comes to diet and heart health. The theme of the new US Dietary Guidelines is Make Every Bite Count, and focuses on how diet impacts our health over a lifetime. In fact, the new guidelines even address changes we should be making in the diets of very young children. However, the health providers we are talking to today work with adults who are diagnosed with heart disease, who also often have other conditions such as type 2 diabetes, obesity, hypertension, and kidney disease. We will get the answers to some important questions about the role of diet and lifestyle in preventing and even reversing the disease process for all of these conditions. Minimally invasive heart surgery is used to treat a variety of heart conditions. Compared with open heart surgery, it typically means less pain and a quicker recovery. New technologies continue to emerge that are changing the way we treat heart disease and changing people's lives. We'll continue to find out more about these new treatments. Continuing our conversation with Dr. Vijay Iyer, an interventional cardiologist, and Marylou Scholl, a nurse practitioner who has been caring for cardiovascular patients for 34 years. Now, Dr. Iyer, we'll start with you. Can you talk about why a physician's experience matters when performing these relatively new procedures?
With all procedures in not just surgery but in interventional cardiology, we know that the outcomes are directly related to volumes that teams do. Many of these procedures require some complex planning. While we can talk about a valve replacement being done in 30 minutes with a transcatheter aortic replacement, it takes a couple of hours of planning to do these, and teams that have a lot of experience doing this can execute these very complex procedures in the safest possible fashion. Taking these complex, elderly, sick individuals through a complex procedure requires teams of people who are dedicated to doing this, but also have a lot of experience. So going to a center that does a large number of these procedures and is able to execute them with good planning is extremely important.
What are some of the important questions some of your patients should be asking when they come into your room?
I think the most important question any patient going to any procedure or any physician should be understanding what are their options. This is the most important first step. Many times patients simply accept what is told to them without asking the next question, which is, what are my options? And this is where coming to an organization like the GVI or Great Lakes Cardiovascular allows you to have multidisciplinary approaches where you can talk to a surgeon, an interventional cardiologist, a regular cardiologist to understand what their options are. The next question you should always ask is, how complex is this procedure and how experienced is the team doing it? It is not unfair to ask your doctor, how many of these have you done? It is not unfair to ask your doctors or your teams, How are your outcomes? How well have your previous patients done? So these are important questions that patients need to ask and not feel diffident about.
And I'm sure with emotion that plays into it too. So just being prepared to have these questions ready to go is important as well, correct?
I think it's absolutely clear. Anytime somebody is told they have a situation with their heart, the first reaction is fear. There's anxiety. Many times people are so wrapped up in that they don't take the step to take a step back and say, what are the questions I need to ask? And this is why it's important when they go to a visit like this, it's good to go with a family member or friend, because many times patients are not able to absorb everything we tell them in one visit. It doesn't matter how smart they are, it just can be overwhelming at times.
It's so good to give insight into that because that's not something people think about, but it's so, so important. Marylou, I love talking about success stories. It's one of my favorite parts about this show. So can you talk a little bit more about some success stories with your line of work?
We have had a lot of patients who want to change their life, avoid invasive surgery, and are very motivated to change their diet, lower their dose of medications, come off medications, lose weight, feel better. They talk about how much more energy they have, and they get their family excited. They get their friends excited. And we've had a few people, 5+ years, avoid open heart surgery, maintaining a very heart-healthy diet, whole food, plant-based. It's difficult for people, but some of these people have a really strong motivation to avoid bypass surgery. They're very motivated, and they want to do this.
Absolutely, and it's not just joy. I mean, it's really life-changing sort of,
It is. It's
emotions.
Joy and energy and feeling that they've accomplished something. It just goes to all parts of you.
And the more you practice heart-healthy eating, the better it becomes. It becomes sort of like your routine, correct?
It becomes your second nature, and you don't even think about other options.
Absolutely. Dr. Iyer, you often praise the work of biomedical engineers in making it possible to perform many of these incredible procedures. Can you talk a little bit more about that as well?
I think it's critical to understand the process of these devices. They don't just happen overnight. Transcatheter valve technology took 20 years to develop. It took a lot of time that the engineers built in taking these technologies, coming up with the concept, refining it to the point where it can actually be done safely in patients. Most patients only see the doctors because they do the procedures, but the work that goes into getting these devices is really done by some very talented engineers, not just in academia, but in industry as well, who allow us to do these procedures in individuals. And I think we don't give enough credit to them many times. And many people are not even aware of the effort that it takes. It takes a lot of effort to take some of these technologies and be able to miniaturize them to the point where it can be done safely in individuals.
And really, just kind of looking into that, where would you even know where to go to learn more about that?
I think in terms of understanding what's out there, there's obviously the internet's a great resource. But for people who want to get into biomedical engineering, for example, I think going to a school like UB and learning through them, for people who want to understand what's out there in terms of new technologies, talking to your doctor and asking the questions. One of our greatest resource for me, is just spending time with patients, talking to them about what are the possibilities. And not everything can be solved sometimes with interventional cardiology techniques. Sometimes we may need to do nothing at all, and there may be other options other than intervention that people can get. So it is a matter of having these conversations, getting yourself educated, talking to your physicians, friends, going online, getting the correct resources, and the American College of Cardiology, and there are many other websites from professional societies that are dedicated to educating people.
Mm-hmm. And it's so exciting to see how our community has stepped into these advancements and really making sure that we're most up to date, really, competitive with what we offer here in Western New York, correct?
Absolutely.
Where can someone get information on where to start so they can stay healthy?
So you want to talk to the person that's taking care of you, whether it's your primary care provider, your cardiologist, your specialist. Great Lakes Cardiovascular has dietitians that we can refer you to if you need to speak to someone. There are a lot of societies, the American Heart Association, American College of Cardiology, a lot of great information that's objective to learn how to stay healthy, make good choices, read your food labels, things like that.
And nutrient-dense foods.
Exactly.
Tell us about that as well.
It's in the perimeter of your grocery store. It's all your natural fruit, vegetables. I say it all the time, the least processed foods that you can buy are the most nutrient dense.
Now, is there any processed foods in the grocery store that are okay to head into? I know that that middle of the grocery store is always so appealing, but is there anything that you can go into and really be okay with your health?
You can have anything in moderation. If you can behave 80% of the time, I say behave, but if you can follow a heart-healthy diet 80% of the time, you can reward yourself.
And I mean, you said everything in moderation, right?
Yeah.
So I mean, you can have sugar just in moderation.
You can. If you tell people they can't have something, they're not going to stick with that. They're not going to think that's believable or sustainable.
Mm-hmm. Especially with the summer months coming up and ice cream
Yeah.
stores are opening. I absolutely agree with you. Dr. Iyer, what are you most excited about now, including any current clinical trials?
We are a center that does in excess of 40 clinical trials just in cardiology and interventional cardiology. There's a lot of exciting new things that are out there. In the world of structural interventions, there is obviously valve replacement technologies that are really revolutionizing how we treat this thing. So there are newer TAVR valves, there are newer mitral valves, there are newer devices to treat leaky mitral valves. That's one aspect of it. And almost all of those trials are now available within Buffalo. People don't need to leave town to get access to these innovative technologies. In addition to that, now we are also embarking on a number of different clinical trials that are looking at what we call strategy trials. What is the better way to treat somebody? Is it better to do surgery or is it better to do something minimally invasive? So those kinds of strategy trials are important because in any new technology, you want to not just prove that it's safe, but you want to prove that it is either better or at least equivalent to existing technologies. I think those trials are extremely important as well. And lastly, we now have a new trial which is really for people who have been told that they're either too sick or they cannot have open heart surgery. It's called Protect 4, where we have the ability to use devices called support devices, called an Impella device, that we can utilize then to fix arteries that people have been told cannot be done because they're either too sick or too old. So there are a number of different clinical trials in cardiology that are available at the GVI. But I personally am most excited about obviously the structural heart interventions, the ability to replace mitral valves or to fix leaky mitral valves. Those are cutting edge. There's literally a new trial every couple of months that we start to get involved in. We believe we have the patient base to treat, and we certainly want our community to have access to the latest and greatest in technology.
Thank you both so much for being here to keep us heart healthy. We appreciate all you gave to us today, and we'll see you soon.
Thank you.
Our guest offered some important information, but I'm sure you may have many more questions or need to connect to seek assistance for your situation. Here's what you need to do if you want to connect with Dr. Iyer, Marylou, and the experts at Great Lakes Cardiovascular. You can reach them by calling 716-710-8266 and online at greatlakescardiovascular.com. Great Lakes Cardiovascular brings together some of the most respected cardiologists in the country to bring world-class care. With 14 convenient locations, Great Lakes Cardiovascular offers the most innovative, non-invasive diagnostic and treatment techniques in diagnosing and treating heart disease. Thanks for watching. Be safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.